A binge in Russia usually begins after a few days of intensive drinking, and then the closest relatives try to intervene, sometimes with determination, sometimes chaotically. The simplest method from the folk repertoire is the so-called klan, that is giving another dose of alcohol to prevent a sudden, dangerous withdrawal syndrome. It is often practiced to dilute vodka with water and to gradually reduce the dose, which is supposed to ease the symptoms, though it is often only a half measure without medical supervision. The first step of a family intervention is to isolate the drinking person, lock them in the flat, and try to limit their contact with alcohol outside. The family usually collects the bottles and tries to control access to spirits, setting up watches or mechanisms to prevent further drinking. Sometimes neighbors join in watching the patient, standing guard at the door and helping the family maintain control over access to alcohol. The first days of a binge are the worst. Seizures, delirium, and aggression appear, and lack of professional help increases the risk of severe health complications. In severe cases, delirium tremens develops, a life-threatening condition that requires immediate intervention and medical monitoring. In the face of threatening symptoms, a narcologist is called, a private specialist in alcoholism who arrives with an IV drip and medications. Many families cannot afford a private doctor, so they try to cope on their own, using home remedies and improvised solutions, which can be risky. Traditional home therapies include pickled cucumbers and cabbage, which are believed to cleanse the body and restore strength after a binge. Russian generations believe in the healing power of cucumber brine, treating it as a cheap antidote and a ritual that restores strength after excessive drinking. Kefir is commonly used as a stomach-cleansing drink, given in quantities and frequencies intended to restore intestinal balance. Soups such as solyanka or borscht serve as a restorative meal after a binge, providing salt, broth, and calories needed by a weakened body. Strong tea and coffee are consumed en masse because they help endure abstinence from alcohol, although they provide only temporary stimulation and do not treat the cause. Garlic and onion are treated as natural antibiotics in the home medicine cabinet, used to boost immunity after a period of heavy drinking. Steam baths in the banya, the traditional sauna, are meant to help sweat out toxins, though this practice is more a cultural ritual than a medical therapy. Aspirin and vitamin C are the cheapest medicines given widely after a binge, because they are readily available and usually present in family first aid kits. The most brutal method is sometimes tying the drinker to the bed, waiting out the crisis and hoping the body will handle the withdrawal on its own. In Russia, there are narcological brigades, teams of doctors who go to homes with intravenous drips and medications to detoxify patients. The arrival of such a brigade takes several hours, during which detoxification and stabilization occur, and the cost of the service is high and often beyond an ordinary household budget. The price of a private visit with an IV drip can equal a month's salary for many families, making the service a luxury available to the few. State hospitals admit people after binges, but conditions are often dire, with shortages of medicines and patients even lying in corridors. Many patients end up in public facilities where there is a lack of staff and sufficient resources, which limits the effectiveness of treatment and post-detox care. Methods of coding are popular. Injections or tablets that induce an aversion to alcohol, their use is controversial and not always effective in the long term. The famous Esperol is sometimes implanted under the skin to provoke severe reactions after drinking alcohol, but the method raises moral and medical doubts. Many people discontinue therapy after a short time and return to drinking because without comprehensive psychological support, addictions readily relapse. Psychological therapy is rarely available in practice and is often seen as a luxury, and its absence weakens the long-term results of addiction treatment. Authorities often apply repressive measures against drinkers, such as fines or arrest, which instead of curing the problem, intensify stigmatization and social exclusion. In social attitudes, a binge is not always stigmatized. Many believe it happens to everyone and that the problem is widespread rather than individual. Families hide the problem because everyone drinks and avoid discussions about treatment, which increases the patient's isolation and weakens the chance of lasting change. A binge is sometimes portrayed as a vacation from life, and people going through alcohol binges are at times praised for their endurance in surviving another crisis. In the villages, people have their own treatment practices and often believe they know better methods than doctors. which hinders the entry of professional care. Neighbors advise a dose of beer as a safe solution, which shows the popularity of homegrown schemes and the lack of trust in medical institutions. Women in families bear the greatest burdens, enduring aggression and poverty while at the same time trying to care for drinking family members. Alcoholism has become so common that it often no longer arouses astonishment, and social indifference slows the response to family crises. After a binge, the body is exhausted, hands tremble, seizures and weakness occur, and full recovery requires time and professional medical care. After a heavy binge, many people return to work only after a week or two, which affects the family economy and increases the risk of job loss. Many lose their jobs because of long absences, as employers do not always tolerate chronic relapses and lack of employee productivity. In villages, drinkers after binges lie sprawled on benches and roads, and this sight testifies to the lack of systemic support and care mechanisms. In cities, the homeless and drinkers occupy parks, stops, and stairwells, which shows the scale of the public health problem and social exclusion. A binge tears families apart, leading to divorces and a dramatic decline in quality of life as well as serious economic consequences for loved ones. Lack of access to care means that sometimes an alcoholic dies at home, left without medical intervention and social support. Statistics suggest that even 30% of men experience binges, which shows that the phenomenon is mass-scale and systemic. Authorities often pretend the problem does not exist because alcohol constitutes a significant source of state revenue and fiscal income. A binge in Russia is not just an individual tragedy, but a mass style of life and death that requires comprehensive political and medical solutions.